curve of the chest, thoracic spine, is called kyphosis. Parts of the spine. Vertebrae. Your spine is made up of small bones, called vertebrae, which are stacked on top of one another and create the natural curves of your back. These bones connect to create a canal that protects the spinal cord and nerve roots. The cervical spine is made up of 7 small vertebrae that begin at the base of the skull and end at the upper chest. The thoracic spine is made up of 12 vertebrae that start from the upper chest to the middle back and connect to the rib cage. The lumbar vertebra consists of 5 larger vertebrae. These vertebrae are larger because they carry more of your body's weight. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Spinal cord and nerves. The spinal cord extends from the skull to your lower back and travels through the middle part of each stacked vertebra, called the central canal. Nerves branch out from the spinal cord through openings in the vertebrae and carry messages between the brain and muscles. The spinal cord ends around the first and second lumbar vertebrae in the lower back and continues as nerve roots. This bundle of nerve roots is called the cauda equina. They exit the spinal canal through openings in the vertebrae, foramen, just like other nerve roots. In the pelvis, some of the nerves group into the sciatic nerve, which extends down the leg. Muscles and ligaments. These provide support and stability for your spine and upper body. Strong ligaments connect your vertebrae and help keep the spinal column in position. Intervertebral discs. Intervertebral discs sit in between the vertebrae. They are flat and round, and about a ½ inch thick. Intervertebral discs are made up of 2 components. Middle. Nucleus pulposus. The nucleus pulposus is jelly-like and makes up the center of the disc. The jelly is partly made of water and gives the disc flexibility and strength. Middle. Annulus fibrosus. This is the flexible outer ring of the disc. It is made up of several layers, similar to elastic bands. When you are standing or moving, weight is put onto the nucleus. In response, the nucleus expands. The annulus holds the nucleus in place. This allows movement to take place, yet maintains the strength of the spine. In effect, discs act as shock absorbers for the spine. The intervertebral disc is a very important structure. Many nerve endings supply the annulus and, as a result, an injured annulus can cause pain. Facet joints. Between the back of the vertebrae are small joints that also help your spine move. These facet joints have a cartilage surface, very much like a hip or a knee joint does. The facet joints are important for allowing rotation of the spine but may develop arthritis and become a source for low back or neck pain. Spinal curves. When viewed from the side, an adult spine has a natural S-shaped curve. The neck, cervical, and low back, lumbar, regions have a slight concave curve, and the thoracic and sacral regions have a gentle convex curve. The curves work like a coiled spring to absorb shock, maintain balance, and allow a range of motion throughout the spinal column. The abdominal and back muscles maintain the spine's natural curves. Good posture involves training your body to stand, walk, sit, and lie so that the least amount of strain is placed on the spine during movement or weight-bearing activities. Excess body weight, weak muscles, and other forces can pull at the spine's alignment. An abnormal curve of the lumbar spine is lordosis, also called swayback. An abnormal curve of the thoracic spine is kyphosis, also called hunchback. An abnormal curve from side to side is called scoliosis. Spinal column scaffold of bone. The entire spinal column consists of 24 individual bones called vertebrae, singular vertebra, plus 2 sections of naturally fused vertebrae, the sacrum and the coccyx, located at the very bottom of the spine. When most people talk about the spinal column, they're referring to the vertebral column, the 24 circular vertebrae that march down the middle of the back. The vertebral column can be divided into 5 regions. Cervical spine, 7 vertebrae of the neck, C1 to C7. Thoracic spine, 12 vertebrae of the mid-back, T1 to T12. Lumbar spine, 5 vertebrae of the lower back, L1 to L5. Sacrum, Coccyx. A normal vertebral column creates a graceful, double S curve when viewed from the side of the body. The cervical vertebrae gently curve inward, while the thoracic spine curves gently outward, followed by the lumbar spine, which curves inward again. This structure gives the spinal column great strength and shock-absorbing qualities. Sacrum and coccyx. The sacrum, or sacral spine, is a triangular-shaped bone located below the last lumbar spinal vertebrae. The sacrum sits between the hip bones, called iliac bones, and forms the back of the pelvis. The sacrum connects to the pelvis at the left and right sides by the sacroiliac joints, SI joints. Immediately below the sacrum are 3 to 5 small bones that naturally fuse at adulthood, forming the coccyx or tailbone. Sometimes the coccyx is termed the coccygeal vertebrae. Although the tailbone is very small and may seem insignificant, it plays an important role in supporting your weight when you sit. A basic understanding of the spine's anatomy and its functions is extremely important to patients with spinal disorders. This information provides a straightforward overview of the spine's remarkable and complex anatomy. We'll explain more about spine anatomy in the next video. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.